Good afternoon. Thanks for joining us again. Let me give you the update on today's statistics first of all. There were 715 positive cases reported yesterday, which was 6.6% of the total number of tests, and means that the overall number of confirmed cases is now 198,184. Of those new cases, 246 were in Greater Glasgow and Clyde, 140 in Lothian and 99 in Lanarkshire, and the remainder are spread across 9 other health board areas. 1,141 people are currently in hospital, which is a slight increase of 9 from the figure we reported yesterday, and 99 people are currently receiving intensive care, which is no change from the position yesterday. No additional deaths were registered in the past 24 hours of patients who tested positive in the past 28 days. But you know by now, of course, that the figures we report on a Monday are often artificially low because registration offices tend to be closed at the weekends. Since the update on Friday, 34 new deaths have been recorded, which takes the total number of deaths under this measurement to 6,950. And again, of course, I want to send my condolences to everybody who's grieving the loss of a loved one. I'm joined today by the Chief Medical Officer, who will shortly help me answer questions. Before then, though, I've got 2 topics that I want to briefly update on today. Firstly, just an update on the vaccination programme. As of 8:30 this morning, I can say that 1,445,488 people in Scotland had received the first dose of the vaccine. That's an increase of 13,546 since yesterday. In addition to that, 1,863 people got their second dose. As you know, we've had slightly lower supplies in recent days, which is why the daily number has gone down. We expect to see that ramp up again in the weeks to come. Take-up rates in all of the initial priority categories, which are categories 1 to 4 of the JCVI list, has been extraordinarily high. For example, we have now given a first dose to 96% of 70 to 74-year-olds and an even higher proportion of 75 to 79-year-olds. And we are well on track to have offered the vaccine to all 65 to 69-year-olds, which is JCVI Priority Group 5, by early March. And as of this week, we are also now starting to vaccinate people with the first dose in Priority Group 6. Priority Group 6 includes people with certain underlying health conditions. These include, but are not limited to, heart disease, diabetes, or a severe or profound learning disability. I can, though, confirm today that with the agreement of the Chief Medical Officer, we also intend to include people with mild or moderate learning disabilities in Group 6, although we will have some work to do to make sure we are identifying and reaching everyone in that category. Priority Group 6 also includes unpaid carers who often need to spend time in close proximity to vulnerable people. It's important to stress at this point that Group 6 is the largest group we will have covered so far. It includes approximately 1 million people in total, which, to put that in context, is more than 1/5 of the entire adult population of the country. Because of that, it will take some weeks to provide first doses to everyone in that group. And so if you don't receive a letter giving you an appointment this week or next week, I would ask you not to worry. We will get to you as quickly as possible. It's likely that the first people to be invited within Group 6 will be those with underlying health conditions identified by the JCVI who are also on the flu vaccine list. These people will be invited at the same time as unpaid carers who receive carers benefits or who have been identified as carers by their GPs. But we're also working to identify people with underlying conditions who are not on the modified flu vaccine list, and if you are in that category, you will be invited for vaccination shortly. And carers who don't receive specific benefits for carers or who've not been identified by their GPs will be asked to come forward to register for their vaccine at a slightly later date, and I expect that to be in early March. So as I say, just because of the size of this group, it will take a bit of time to work through everyone in Group 6. And of course, as always, the speed with which we can offer first doses is dependent on our supplies. So I'd ask everyone who is in that group, I know this is really hard, to show some patience as you have been doing already. But the good progress we've made with the programme overall so far, I hope will reassure you that we will invite you to get your first dose just as quickly as is possible. There's one other point on vaccine that I just wanted to highlight today because it is very good news. Edinburgh University this morning has published the results of a study showing that by the 4th week after getting a first dose, the Pfizer and Oxford AstraZeneca vaccines reduced the risk of hospitalisation from COVID by 85% and 94% respectively. That is exceptionally encouraging news, and on this Monday, I hope it gives all of us that little bit of optimism that we need now for the future. Now, the final point I want to highlight today is just to remind you there will not be a media briefing here at 12:15 tomorrow. Instead, I'll be giving a statement to Parliament, which will be at around 2:20 tomorrow afternoon. That statement will set out our current thinking on the overall state of the pandemic, and it will provide details of the revised strategic framework document that we are publishing tomorrow. Now, as I said last week, the framework will not set out hard and fast dates for the easing of all restrictions. As I indicated last week, it's really important in this stage of the pandemic, particularly given everything we learned from our emergence from the first lockdown, that we are driven by data more than we are driven by dates. However, we will seek to set out tomorrow an indicative order of priority and the likely phasing of, firstly, the gradual lifting of the current lockdown restrictions, and then in due course a return to the geographic level system when we would decide whether all or parts of the country maybe moved out of level 4 down to level 3. And of course, that's the point at which more parts of the economy would start to open up. Now, this will be a cautious way forward because it's really important that as we come out of this lockdown, we do so sustainably. We've got every reason to be very optimistic right now. The lockdown is working and all of the indications are that vaccination is having an impact as well. But we don't want to set back our progress. We don't want to, while there can be no guarantees, we don't want, if we can avoid it, to face another lockdown. So sure and steady, even if it is a bit slow over the next few weeks, is definitely how we want to proceed. As I've said before, in all of this, there are hard choices to be made if we can't do everything all at once. So what we set out tomorrow will be very clear again about the priority we are placing on the education of young people and getting young people back to school as quickly as possible. That priority is, of course, very evident and in action today. Many children in early education and childcare and in primaries 1 to 3 are going back to nurseries and school buildings today for the first time since before Christmas. And in addition, some, albeit a limited number of senior secondary school students, are able to return to school to carry out essential practical work for their national qualifications. So I hope that all of those children and young people getting back to school today enjoy seeing their friends, their teachers and others in person again. And I want to take this opportunity to thank all childcare and education staff and their leadership teams for all the work that has been done to prepare for today and everything that all of them are continuing to do to support remote learning for other children. Today is undoubtedly an important milestone and a very welcome milestone, that first step to restoring greater normality to our lives. And I know it will be a particular relief to many parents across the country. But it's really important that we remember that it has been made possible only by the sacrifices we've all made to bring numbers down. Our headroom and room for manoeuvre remains limited. So we hope that more children will be able to go back to in-school education next month, but our ability to achieve that depends on our ability to continue to suppress the virus. Over time, vaccination will play a bigger and bigger role, we hope, in allowing us to do that. And as I've said earlier on, all of the early indications about the impact of vaccination so far are very positive and encouraging. But for the moment, the vital thing that we all need to do to keep the virus under control is to continue to do all the things that have been driving case numbers down over these past few weeks. So let me close again by emphasising the key advice. The most important thing of all right now is to stay at home, except for essential purposes. That rule is going to be in place for a little bit longer. Don't meet up with other households indoors. Outdoors, you should meet with no more than one other person from one other household. Please work from home if you can, and employers remember to support your workforce to do that wherever possible. And if you are a parent whose child has returned to school or nursery today, I'll make again a particular plea not to have your child's return lead to an unnecessary increase in the number of contacts that you are having with other adults. I know that is difficult, but it is really important that this return to school is just that, so that it doesn't then lead to an increase in transmission and send our progress back the way. More generally, when you are out and about, whoever you are, please remember to follow facts, face coverings, avoid crowded places, clean your hands and surfaces, use 2 metres distancing, and self-isolate and book a test if you have symptoms. It's by continuing to do all of this that we will be able to continue down that path that we have started on today in getting some children back to school, a path that does lead, hopefully, over these next number of weeks to much greater normality. But it will take discipline, it will take common sense, it will take patience for us to do that. So I appeal to everybody again to continue to show all of these things, just as the majority have been doing so far. Thank you again for listening. We'll go now to questions, and Gregor will obviously help me answer the questions. First today, Gordon Cree from STV.
Thank you. You've talked about the cautious approach to moving forward from here. Obviously, later today, we'll hear what's coming out of Downing Street. To what extent do you expect, if we can call it the Johnson plan and the Sturgeon plan, to be similar, and to what extent do you expect them to diverge in the coming weeks and months? And can I ask the Chief Medical Officer on vaccines, firstly, how encouraged he was by those figures from Edinburgh University this morning, and whether that adds some more justification to the 12-week rather than the 3-week strategy. And also, we've heard from some cases of people in their 40s who don't, they say, appear to fall into any of the other groups you've talked about, getting invitations for vaccine appointments. Should they go and get them because they've been invited, or should they stand aside for people who might fall into one of the other groups?
I'll hand over to Gregor on the points about vaccination. On the route maps out of lockdown, I've just come from, I had to leave it early to come and do the briefing, but a Four Nations discussion that is probably still underway, actually, given an update on what the Prime Minister will set out this afternoon. I'm not going to preempt his announcement, so I'll only comment in terms of what's already been suggested in the media. I would think that while our plans out of lockdown will not be identical. They're already not identical because we've got some kids back in school today, which is not the case in England until into March. So they will not be identical, but I think there will be broad similarities. Firstly, from what I read about the announcements the Prime Minister is likely to make later, and I welcome this, he's likely to set out a careful and cautious way forward, and I think that's really important. I think it is vital that we learn from past experiences, and similar to us, it seems that they will prioritise children and education and getting life back to normal for young people before doing other things. So I think the principles will be the same. We're living through the same pandemic. There is a limit to how much it is sensible to diverge in circumstances that we are facing in common. But clearly we will make our own judgments about the particular order and the particular timing of that, because the data is not identical in each of the Four Nations as well. So we've got to, as we have done all along, and I think it served us reasonably well, we'll make the best judgments we can here, and I'm sure Boris Johnson, Mark Drakeford, Arlene Foster and Michelle O'Neill will do the same for their respective countries. I'll hand over to Gregor on vaccination. Just on the Edinburgh University study this morning, which is hugely positive, and actually backs up and reflects some of what we were seeing in our own data last week in terms of deaths that came from National Records of Scotland. So it's good to see that backed up in a study, which I think is probably the first whole country study of the impact of vaccination and hospitalisations. The bit that we don't yet know quite as much about is the impact of vaccination on transmission of the virus. But the early indications of even that are positive. We just need to get more data to be surer about that. So everything that has been reported to me about the vaccination programme gives me every reason to feel positive and optimistic, and that's important. But it's going to take us, even with good supplies coming forward and being able to accelerate this as much as possible, which we hope to do, it's going to take us a bit of time to get through the whole adult population. So until we do that, until we have got more certainty about the impact, we have to continue to play our part in driving cases down and keeping them down. On the vaccination more generally, I'll hand over to Gregor.
Thanks, First Minister. So Gordon, I'm really excited just now because of the number of vaccine studies that we're about to start to see being published, and that will give us much more information about the actual vaccine effect that we're seeing at this stage. We must continue to track that over time. But I agree with you that it's incredibly encouraging to see what is a very high quality piece of research from the Usher Institute, led very well by Professor Sheikh and his team, to give us this initial encouraging news about both vaccines that we're currently using in this country, and the size of the effect that we're seeing on reducing hospitalisations at this point in time, 85% and 95% respectively for the two vaccines, is for me beyond what I would have hoped to have seen at this point in time as well. Now, as I say, we mustn't become complacent. What we must continue to do is to continue to track this data over time to make sure that we're seeing that same effect being maintained over time. But I think particularly encouraging for me, in light of the question you asked about the dosing schedule we've adopted in the UK, was that vaccine effect was an increasing effect over the time of these observations. Now, as I say, we must continue to chart those observations, continue that piece of work forward. But at this point in time, it does seem that the vaccine effect increases over that time period as well. Over coming days and weeks, we will gradually get more data, particularly about the effects on mortality, and gradually we'll start to see more and more data coming through about transmission as well. But for those countries such as Israel who are already reporting in relation to these, again, I think we can take a lot of encouragement that we're starting to see the signs of effect on both mortality and transmission as well. And that's backed up with some of the initial data we've had from NRS that we spoke about last week as well. So at this moment in time, all the signs are good, but we must remember this is just a proportion, small proportion so far of the population who've had this vaccine. We must continue to run through the rest of the age groups, continue to address the risk that still exists within the population there, and make sure that all of us continue to take as many steps as we can to reduce transmission while that vaccine programme proceeds. In relation to the second part of your question, which was about the few people who have received invites which they don't understand why they've had it, we are aware that there are some people both in the Glasgow area and perhaps also in the Ayrshire area just now who've had some invites that they don't understand why they've received them just now. We're investigating as to why that's the case. It's possible that it's due to coding anomalies in the record, but these are a very small number of cases. My advice to you is if you've received one of these invites, you don't quite understand why you've received the invite, then perhaps phone the vaccine helpline. We can make sure that that number is available for people so that you can speak to someone who can provide you with advice as to whether you should proceed or not.
Thanks. Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, ITV Border has been speaking today to one hotel owner near Peebles, been shut since November, staff have been furloughed, losing money. Now, I know you said today that you can't give any hard and fast dates on easing of restrictions, but people like this person who are running a hotel think at least if you're able to give them some kind of timeline, then they could plan to get their businesses back up and running. And I suspect the same would apply to self-catering businesses. Can you give them any hope?
I'm not going to give people false hope. There's no point me standing here just answering that question in the way that I think people want to hear, knowing that right now I can't have certainty about it. We will set out tomorrow, and I'm not going to go into the detail of what we'll set out tomorrow. I'll do that to Parliament, as much of a sense of what the future looks like as we can, but it has to be driven by data. So I could stand up here and, to make my life easier, give a date, but by the time we get to that date, unless we've got the data in a place where we think it's safe to open up, it would be meaningless. So we need to, the key thing I need to say to people right now is we're going in the right direction, both with suppression of the virus and with the vaccination programme. We need to keep that going. And the the more we suppress, the quicker we do that, the quicker we get people vaccinated, the quicker this opening will happen. But we have to be driven by what's happening with the virus, because otherwise it will run away from us again. We know that we are, we're dealing with a slightly different beast than we were when we came out of lockdown the first time, because of this new variant that is so much more infectious and spreads so much more quickly. So that means we do have to be that little bit more cautious. But I want to get hotels, restaurants, pubs, everything open up as quickly as possible, just like everybody else does. But I've got a duty to make sure that the decisions we make are as safe as they can be, so that when we open hotels this time, whenever that happens to be, we've got a reasonable prospect of keeping them open, and that we're not then going to be faced with having to shut them down again just a few months down the road. And that's why sustainability here is really important, as well as the speed that everybody wants. Laura Goodwin from BBC.
Hi, good afternoon. I know it's difficult to give exact dates for many aspects of the unlocking process and the vaccination process, but nonetheless, the Prime Minister has said that all adults will be offered a first dose of a vaccine by July the 31st. Is that a date that you think is achievable in Scotland too? And as we know, the vaccination process has had to slow a little bit to allow for this supply issue. When do you anticipate that it will be back up to full capacity?
Well, capacity is driven by supply. So we are operating at full capacity right now based on supply. You can have capacity in terms of vaccinators and premises, but if you don't have the supply, that's not real capacity. So we will always go at full capacity. What that full capacity is will be driven by supply. What we don't want to be in a position of, and are not, and this is the challenge, of having more supply than we have the ability to deliver that supply. So as soon as the supplies start to flow in greater volumes again, which will happen, then we increase the rate of vaccination. We, over, I think, the last week, had thought we would have supplies to do about 200,000 vaccinations. I think we've done slightly more than that. But that supply constraint is why you will see yesterday that daily rate dipping a bit, not because we didn't have people to do the vaccinations, because we just didn't have the supply, bearing in mind that we're also now having to earmark supplies to do the second doses. On the first part of your question, I think we made this pretty clear yesterday. So yes, if we have the supplies, we think we can meet the 31st of July target to do the whole population. We are waiting on updated supply forecasts to give me certainty and to give the Health Secretary certainty that we will have those supplies, or we can at this stage assume we will have those supplies, and therefore say yes, we think we've got the supplies to do that. But what I'd say right now is if we have those supplies, we will do that, and we will vaccinate as quickly as possible. The daily rate that we were meeting a week or so ago was the highest proportionately daily rate of any country in Europe. So we've shown that we can really make this vaccination programme motor. But obviously the single most, the biggest constraining factor on it is going to be the volume of supplies. So I would hope that the JCVI list, which we've always said by May, I would hope, supplies permitting, we could bring that forward to around about the middle of April, the Prime Minister indicated, and then the adult population by the end of July. But we need to have that certainty in supply before we can be absolutely firm about that. Aisha Tull from Channel 4.
Thank you, First Minister. I just wanted to ask, at a primary school at the moment, and you could see that parents and kids are radiating with joy about being back, but the numbers, the R rate is still 0.7 to 0.9. There's not a lot of room for manoeuvre, and unions are saying, one union in particular was saying that couldn't half kids come in and half kids be taught online? Wouldn't that be a possibility? Are you being cautious enough with kids at the moment?
So one thing I've learned over the last year is whatever decisions we take, some people will say they are too cautious and some people will say they are not cautious enough. That's understandable because this is not easy and there are no, sort of magic, perfect formulas to this. We've got to make the best judgments we can. So we think we've got very limited headroom given where the R number is, but we think that headroom is sufficient to allow what has happened today in terms of early years children, primaries 1 to 3, and a very limited number of senior phase pupils. We didn't think it would have been possible to go beyond that and have a reasonable degree of confidence that we can keep the R number below 1. Now, we think what we have enabled to happen today, assuming, and I make this point bluntly, as I have done a few times over the past week, assuming that it is literally only about getting kids back to school and that the adults, the rest of us, don't take it as an opportunity to increase our own interactions with other adults, then I have a reasonable, not a certainty, but a reasonable confidence that we can achieve that without the R number soaring again. But the reason that we will not immediately take a decision about the next phase of school return is that we have to monitor that carefully over the next couple of weeks. So we said it is unlikely that any more children will be going back to school before the 15th of March, and obviously at the start of March we'll set out our up-to-date thinking on that. So this is about being deliberately cautious. I'm really pleased we've managed to get some children back to school today, because I worry, you know, and I know this is as nothing compared to the concern parents have, but I worry more on every day that passes about the impact of this pandemic on our young people. So it's really important to prioritise their interests here. So I think the decision we've taken now is the best one in terms of the balance we had to strike, but we need to monitor it over the next couple of weeks. And we're very, very frank about that. Gregor, do you want to say a bit more just about the balance?
So the first thing to say is these are never easy decisions, but looking at the evidence as we have done over the several weeks now, examining exactly the potential impacts of returning different year groups to school and modelling that impact on the general population is something which we've taken great care and attention to. And you've got to balance the risks of the upward pressure on R that you've spoken about, because there's no action that we take to bring people back together that won't have an upward pressure on R. That we cannot bring people back together and not expect that there will be some impact as a consequence of that. But the important thing is to model those effects very, very carefully to make sure that we've got sufficient headroom and that it's safe to do so. And so our judgment is that by taking the very cautious approach that we've proposed here, making sure that it's particularly those younger age groups who return to school, first and foremost, where we know that there's certainly much less likelihood of transmission between those people. That's the best way that we can then begin to get some of these kids back into face-to-face education, whilst very carefully tracking any impacts that may have on wider society as well. And if we're being very honest here, the impacts on wider society are likely to come from the increase in freedom that parents have and the ability for parents to then move about, and whether it's conversations at school gates, whether it's return to work, it's that produces the greatest degree of risk. So again, my plea to parents of returning children just now is to make sure that you're doing all that you can so that you're trying to limit the impacts of your own behaviours on providing that upward pressure on transmission just now. And if we all act together in this way, then we're much, much more likely to be able to keep our children in school, where we know that they'll benefit to a much greater degree to that face-to-face education.
Alan Smith from Bauer.
Thank you, First Minister. Just in regards to the route map, I appreciate you're going to be setting out more details tomorrow, but Radio Clyde has been speaking with the Scottish Weddings Industry Alliance, who are calling for the resumption of weddings with 50 guests, and they say that the industry is well placed to operate very COVID-secure events. I was just wondering if you could give us sort of any indication as to the priority things like weddings will be given, and what you would say to those couples hoping to get married in the coming months. And a question for the Chief Medical Officer. On Friday, we raised the issue of people being sent letters in error, people in their 20s and 30s. Following the briefing, we spoke with a 25-year-old, seemingly healthy 25-year-old, who did question it with her GP, and the GP told her that if she didn't go for the vaccination, she would be marked down as refusing, and that could make things more difficult for her down the line. So on that point of people who may have been sent these invites in error, should they go ahead and get that vaccine? She did say she felt incredibly guilty, but she was worried what happens if she refuses that vaccine.
On your first point, look, I'm not going to get into detail about what I'll set out tomorrow, but I'm equally not going to stand here and give people a sort of false sense of the speed at which we can do this. Everybody wants to be the first priority, and I absolutely understand that. Every sector I speak to will say we can operate COVID-secure environments. I don't doubt the effort and hard work and investment in many respects that different sectors have put into that. But we know from experience that with the best will in the world, when we bring groups of people together, particularly in social settings, the virus spreads. And we ignore that at our peril. And it would mean we are not learning the lessons we learned last year. So we're going to have to be patient for some of this, and government is going to have to continue to support sectors that are still very restricted in what they can do. Our top priorities are children and young people, getting them back to education, care home visiting, which we set out new guidance on at the weekend with the view to introducing more care home visiting options for people by the start of March. Beyond that, I think people want to be able to see their loved ones. That may be outdoors before it is indoors. But these are the kind of order of priority. When we get to a position that we can come out of for part or all of the country, so we'll effectively go through over the weeks to come, a sort of phased approach to the lifting of the current level 4 restrictions, and that will be, uniform across the areas that are subject to level 4. And then when we think we can move back into the level system, the whole country may be able to come down to level 3 again, or we may be able to take parts of the country down to level 3. And that's when more economic opening up might be possible. We are going to have to be patient here. We've come this far and it's been really, really horrendously difficult for everybody, and some more than others. It would really be the wrong thing to do to come this far on suppression after a second national lockdown, and particularly with the vaccination programme going so well, and ease up too quickly right now and send ourselves back the way. So patience is a hard thing for me to expect of from people and to ask more of from people. I know that. I hate having to do it. But the more sensible and cautious we are right now, the more sustainable these easings of restrictions will be, so that, whenever we do get to a point that we can go for a drink in a bar, even if it's outdoors, where there can be more people at wedding receptions, then that's something we can look forward to being the case for the long term, and that we're not very quickly then heading back into a situation where we're tightening up again. So this is really difficult, I know that, but we have to stick with this if we're going to come out of this in the shape that we want to be.
Alan, I was very grateful to you for raising this matter on Friday, and since then we've had teams that have been examining as to why it may be that there's a very small number of people who've received appointments when they don't understand why they should do that. Usually it's because they're a younger age group and wouldn't recognise that they have an underlying condition that would entitle them to vaccination at this point in time. Whilst we are determining exactly why those people have been invited, we could just perhaps look at the accuracy and the completeness of some of the GP data sets, that the extractions to call people for invitations perhaps might have led to some anomalies within the system. If people receive one of these invites and they don't understand as to why they've been called forward at this point in time, why they've been invited to come for a vaccine, my advice to them is that they should phone the vaccine helpline. Now, they can do that by contacting 0800 030 8013 and speak to one of the operators there who'll be able to provide them with further advice. But let me tell people just now and reassure them that they will not be disadvantaged if they do not go for their vaccination appointment at this point in time. It won't mean that they won't be able to access it in the future if that is the case, that they've simply been called prematurely. And we will make sure that we take their details so that we can make sure that they're put back into the programme to be called at the appropriate time.
Jack Foster from Global.
Good afternoon, First Minister. No doubt today is a red letter day for many families and parents in Scotland, with some pupils going back to school. Now, the reasons for closing schools after Christmas are well known, and the need for that slow phased return makes sense. But many young people across Scotland are feeling hopeless about the fact that there's not really any light at the end of the tunnel, seemingly, as they still see no real idea of when they might be back in class. And I know that you obviously can't predict how this phased return will go, and by definition, we'll find out these crucial dates as we go along. But for those young people and teenagers in particular who are beginning to see their mental health taking a toll, can you give a sense of the latest that they're likely to have to wait before they can be getting back to school? And in particular, I wonder what you say to those young people in the later years, like sixth year of school, who are maybe looking at this and thinking, perhaps I just won't get to go back for that most crucial last few months, formative months of the school.
Well, I want that not to be the case. I want to get children back to school before the summer, but I would not be being fair to anybody if I said the latest date is this, because I don't know that right now. What I do know is that getting children back to education is the top priority. We've done that today. I think we're the first part of the UK to set the date for some children going back to school. I think children in Wales in the same years as in Scotland are going back to school today. England and Northern Ireland are a bit later. So we've shown that priority. We will set out on the 2nd of March what we think the next phase of school return will be. I've said, in order to give as much certainty as possible, and because we need to monitor what's happening today over a couple of weeks, that is unlikely to be before the 15th of March. But I really hope that we will get more children back to school later on in March. And then we will set out as far as we can what the schedule beyond that is. I think that is the fairest way to do it. I'd love to be able to stand here and say pubs will open on this day, tourism will open on this day. I'd love to do that, but I would love nothing more than to stand here and say every kid will be back in school by X date. But it wouldn't be fair to do it that way. So this is the proper way and the only way to do it. And I know I've got a niece and nephew of my own who are in that secondary school, kind of mid-secondary school phase. And I don't see because I don't see them right now, but I hear it when I speak to them, the impact it's having being away, not just from school and education, but from friends, from the normal experiences of being a teenager. It's horrible. It's awful. It's the worst thing probably about this whole pandemic, apart from the death toll. So I can't find the words to say how desperate I am to get young people back to some kind of normality. And that's why it has to be the priority. For the rest of us, that means being more patient. That means waiting longer before we can do the things that we might want to do. But I think that's worth it if we can prioritise the mental health and broader well-being of young people. Katrine Bussey from PA.
Hello, First Minister. I too wanted to ask about schools, and obviously you've described today's partial return to classroom learning as an important milestone, but it's important to remember, I think, that that's only for quite a small number of children. We've seen over the weekend the UK government indicate that all children and all schools in England will return to classes on March the 8th. Now, I appreciate you probably don't want to comment on decisions made by other governments, but could you tell me why your government has decided against such an approach?
I think if we were to do that right now, we would send transmissions through the roof again very quickly. And because of all of the interactions, that's not about fear of transmission inside schools as much as about the overall interactions that would spark in the wider population. I'll let Gregor speak because he's one of the ones who advises me on this, so I'll let him put it in his own words what his advice to me would be. We think what we're doing today, a couple of weeks earlier than any return in England, but on a very careful and cautious basis, allows us to make the start to that progress. It allows us to assess just what the impact of it will be, and hopefully it means that later in March, as I've said, not before the 15th, but hopefully from then on, we can start to see more children go back to school. But if we do this in a way that sends the virus out of control again, then what we'll be facing is all schools being shut again, and even the kids we've got back today not being in school. The key word here is sustainability, and the key term is trade-offs. We can't, with an R number at 0.7 to 0.9 as it is just now, that's very, very limited headroom. So we have to be very careful about not overspending it so that it goes above 1 very quickly, and to decide what we want to spend it on. We can only spend it once, and we're choosing to spend it today on getting some children back to school. And hopefully what will happen over the next 2 to 3 weeks is that cases will come down further because the rest of us stick to lockdown, that vaccination rates go up and we become more confident about the impact on transmission of vaccination, and we become confident that the partial return to school hasn't had a really negative impact on transmission, and so we'll feel confident then about getting the next tranche of kids back to school. I think that is is it ideal? No, because I want every child back to school right now. But I think that is the most sensible and sustainable way of trying to do this in a way that's going to stick. And that, after a year of this misery, that's really the important thing, getting us out of this lockdown in a way that sticks and doesn't have us going back into one later in the year.
So that caution and sustainability is really, really important in all of this. I am absolutely delighted that these kids have gone back into school today. And when I hear some of the stories already of the joy in their faces as they've been doing that, as they've been seeing teachers or friends that they haven't had contact with for a long time, it's wonderful. But I'm also a little bit uneasy about it as well, because we need to make sure that we're tracking the impact of this. Now, when I say tracking the impact, we know that whenever schools return, then it's not so much even the impact that the schools have, but actually how the rest of the population behaves beyond that. Because as soon as children are back in school, it allows the rest of the population just a little bit more freedom to act, and the possibility that if people are not careful, that they create more opportunities for the virus to transmit between them as well. That's why it's really, really important that we take a cautious and sustainable approach to the return of the schools just now. And over the next 3 weeks, we'll be tracking very, very carefully exactly what happens with transmission. So are infections changing at all? And if so, where are infections changing? How are we seeing the kind of the locus of cases where people have been coming together in test and protect conversations? Are we seeing any locations which are becoming particularly more evident there as well? So we'll be tracking that data very, very carefully over the next 3 weeks. And at that point in time, we'll then be able to make a decision as to whether the modelling, which we've so very carefully examined in the lead up to this return, is exactly tracking through as we would expect. And if everybody plays their part, and if everybody makes sure that they're very cautious in terms of limiting the ability of this virus to transmit between people outside schools, then I'm fairly confident we'll get to a position in 3 or 4 weeks' time when we can start to consider, well, what are the next stages that we start to build on again, and so forth. But it really relies on each one of us exerting our own responsibility and accountability to make sure that we can continue with this track for the kids just now.
Chris Musson from The Sun.
Hello, First Minister. You'll have seen Downing Street's 4 conditions for moving between phases of their lockdown exit roadmap have been widely reported this morning. Notably, this doesn't appear to be an elimination strategy, which is what you suggested you will pursue. So, related to this, can you see travel restrictions between Scotland and England remaining in place longer than they otherwise would if Scotland pursues an elimination strategy and England does not? And also, just related to this big picture of UK-wide cooperation, you presumably agree that as much joined-up thinking as possible is needed for this lockdown exit to be sustainable across the UK. So just wondering why you left this Four Nations call to do this briefing, or at least why you're not on it. You said it was still ongoing, I think.
Because I do this briefing every day. I wasn't in charge of the timing. We pointed out that I do this briefing when a call was scheduled for 11:45. I joined it for as long as I could, consistent with my regular commitments, because if I hadn't turned up here today, no doubt you would have asked that. The call was only set up, I think, yesterday, and I'm represented on the call by officials when I'm not there. Wasn't in charge of the timing. I went to it for as long as I could. It wasn't a discussion about, as I understand it, what we were all doing. It was a report on what the Prime Minister was about to announce. So, people people will criticise me for whatever I do in relation to the UK government, so I'm just going to do what I think is right and what discharges my responsibilities to the best of my ability. In terms of an elimination strategy, I think we're not pursuing some kind of ideological approach here. We know from experience that if you allow this virus to circulate at relatively high levels, you're never out of danger of it just taking off and completely overpowering you again. So you have to get it as low as possible. We also know, and this is actually much more pertinent now than it was last year, this virus is mutating, and viruses mutate when they're circulating at quite a high level of community transmission, and that's when you've got the risk of new variants. So, you know, you try to get it as low as possible, and, you know, even if you don't eliminate it completely, the very act of trying to do that will get it lower than it will if you don't try. And I'm not sure that in actual practical terms, we might use different language for it, but others would have to speak for themselves. I'm not sure there is that great a difference in what we're trying to achieve. If we don't get it as low as possible, we are always facing the risk of being overwhelmed by it. So that's what we will continue to do. Travel restrictions and the decisions on those depend on a whole range of things, and we'll set out the future policy on those as and when these decisions fall to be taken. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. Much of Boris Johnson's relaxation of lockdown restrictions won't actually take place till the end of next month at the earliest, other than schools. And this morning, John Swinney had talked about the need for continuing population-wide activity to suppress the virus to the lowest possible level. Should people be anticipating, at the very least, several more weeks of the stay-at-home order and national lockdown restrictions? I know that you've talked today about the schools' next phase potentially being the middle of next month. Is it pretty much impossible for anything to happen with other restrictions until that takes place and you're able to assess the impact of that?
I'll set this out tomorrow. As of now, the stay-at-home restriction is in place until, as I said the last time, at least the end of March, and I'll update Parliament on that tomorrow. I can't go further consistent with my obligations to give Parliament the detail first. Georgina Hayes from The Telegraph.
Thank you, First Minister. Given that the vaccines have been shown to reduce risk of hospitalisation so substantially, if the government is pursuing a data not dates approach, does it not make sense to ease restrictions sooner rather than later once the top priority groups have been vaccinated by mid-April, given that they account for around 99% of COVID deaths?
I'll let the Chief Medical Officer say a word about this. I mean, reducing deaths and hospitalisations is, you know, a key priority. That's why the JCVI recommended an initial approach to vaccination that was focused on morbidity and mortality. So that is right. What we also know, though, is, you know, wider transmission of the virus is still an important factor. So even if you are reducing mortality and morbidity through vaccination, if you're still allowing it to transmit, and if, you know, the vaccine is not reducing that significantly, though all the early signs are that it, and we are hopeful that it will, then you're leaving a lot of people that might still get the virus. They might be less likely to become very, very ill and die, but you've still got long COVID, and you would still have a burden of illness in the population that would put a severe pressure on the health service. So we've got to see this in the round and take all of these decisions. What we know now, when we were coming out of lockdown last year, you know, we had several tools in our toolbox: test and protect, you know, continued protective measures. We've got this other massive tool in the toolbox right now, which is vaccination, which we think in time is going to take a lot of the pressure of keeping this virus suppressed. But we need to be careful that we don't run ahead of that, because if we do, then the virus will run out of control again and we'll go backwards. So this all has to be done carefully with real consideration to the optimum timing of it.
It's great news that we're starting to see this effect on hospitalisation coming through with the data that these academic groups are producing just now, and I expect that over time we will see similarly encouraging results in relation to mortality. And of course that deals with the groups who are perhaps most at risk from dying or serious illness from COVID-19. But of course, if I was to speak to my colleagues in the emergency departments, in the hospital wards, in the ICUs across the country. They're seeing people still coming into hospitals seriously ill from other age groups as well, and it's really important that we take that into account as well. So this is not all about just those people in those first 9 groups that are most at risk, particularly from dying as a result of COVID-19. People can still become very seriously ill even beyond that in those younger age groups, and it's really important that we always remember that fact as well. The other aspect that we need to be very careful about, of course, is the ongoing issue of prevalence of the virus within our communities as well. As we gradually vaccinate more and more people, we start to exert more and more selection pressure on the virus, which means that these mutations that the First Minister has referenced there are more likely to start coming through. Now, if we can reduce the prevalence of that virus within the communities at the same time as expanding that vaccination programme, there is much more likelihood that we'll reduce the number of mutations that we start to see coming through here. And that's why pursuing that elimination strategy that First Minister has just referenced, getting the numbers as low as possible, has that additional benefit of making sure that it helps to provide better protection for our vaccination programmes in the future as well.
David Ball from the Herald.
Thank you, First Minister. Can I just get a bit of clarity about whether travel restrictions will need to remain when rules are eased? So, for example, when people can meet again outdoors, is it likely that we may not be able to travel between local authorities to do so? And do those travel restrictions between high and low prevalence areas become even more important as case numbers are suppressed to hopefully very small numbers? You've also said you'd like to go back to sort of the tiered system that we had in place. Are there any sort of geographical areas that are causing concern at the moment where maybe prevalence isn't reducing as much as other areas, and could they see restrictions eased at a slower pace?
No, I would caution against looking at any area just now. It will be a little bit of time yet before we're back to that geographic level system, but hopefully we can see a path to that. If I could give you greater clarity on the first part of your question right now, I would, but I can't. You know, we will not have travel restrictions in place any longer than is necessary, but we know in terms of international travel that is likely to be necessary for some time yet because of the need to avoid importation and the necessity in terms of travel between different parts of the UK or even within Scotland will depend on what happens with the data. These things have to be data driven. So I'm not going to stand here and try to pretend I can give clarity on these points before I am able to give that clarity. But as soon as I can, I will. Matt McLaughlin from The Times.
Good afternoon, First Minister. Can I check something that John Swinney said this morning? He said that he would not be permitted to follow the timetable of Boris Johnson in reopening schools. I just wanted to check that word permitted. Whose permission does he need? And we're talking about the trade-off, too fast, too slow. When you're in a room with scientists like Mark Woolhouse saying go faster, and people like Devi Sridhar maybe saying go slower, how do you balance that? Do you use your own moral compass, party policy, things like that?
I've no idea on the first part of your question. I didn't hear John Swinney. I'd have to ask him what he meant by permitted if indeed he used that term. So I'm not going to try and second guess him. I'm sure he knows what he meant, so I can't answer that question right now. It certainly wouldn't be me he was talking about because we take these decisions collaboratively on a cabinet level. And in terms of the first question, I have a team of advisors, a group of advisors, and there are differences of opinion, spectrum of opinion within them. But the job of the politicians, it's not their job to take the decisions. It's my job to take the decisions with my cabinet and be accountable for those decisions. And there's a whole range of factors we'll be taking into account. Preset policy is not one of them. Certainly party policy is not one of them. I don't think there is party policy on a pandemic. We have to follow the data, make judgments, think. So I'll give you an example. There will be I'm not saying there was specifically on this issue differences of opinion within the advisory group, but say there had been, for example, of maybe you should open something else before you open schools, I have to make a value judgment. Well, actually, I think getting kids back to school is the most important thing. That's the job of somebody like me. It's over the past year been, perhaps a lot more difficult than it even is normally, but that's what people elect people like me to do, to take the responsibility of the tough decisions. Jane Bradley from the Scotsman.
Thank you, First Minister. And we've heard some great news today about the vaccine preventing hospitalisations, but I was wondering if there's any evidence so far about the impact of the vaccine on long COVID, which has so far affected thousands of people in Scotland, and it's not always linked to severe forms of the illness in the initial days. So if someone gets a mild form of the illness after having had the vaccine, are they still likely to suffer from long COVID, or is that a possibility?
I'm not aware of any data on the impact on long COVID, but I'll hand over to the Chief Medical Officer in case he is.
It's a very good question, but at this moment in time, no, there isn't sufficient data to suggest any influence on long COVID. It's clearly something that research groups will be looking at over time, but at this moment in time, we're just too early in the vaccination programme to really be able to assess that.
Richard Percival from the Express.
Thank you, First Minister. I just wanted to ask about the international quarantine rules and regulations. Firstly, do you have any sort of figures, an indication of how many people are currently Scotland quarantine hotels? And second,
I'm not hearing you. You're breaking up. Sorry.
Can you hear me now, First Minister?
I can hear you. It started to break up, but carry on and see if we get any further this time.
Can you hear me now, First Minister?
Yep.
Hello?
Yeah, I can hear you, so do you want to...
Okay, I just want to ask about the international... Yep. I just want to ask about the international quarantine regulations, First Minister, and do you have an indication of the number of people in Scotland's quarantine hotels at the moment? And secondly, do you have a response to Deputy Chief Constable Fiona Taylor's comments that any form of border checks are doomed to fail, and they wouldn't intervene in any form of checks at all because we are a United Kingdom?
I've not seen DCC Taylor's comments to that effect, so I won't comment on them just now. I'll go and look at them, and if I've got any comment I want to make, I will, but operational matters are for the police. I don't have the figures on the current numbers in quarantine, managed quarantine right now, but again, we can get those for you. We have figures, I just don't have them with me right now. Okay, Tom Magner from Carers World Live.
Thank you very much indeed, First Minister. Our viewers certainly welcome the start of the Band 6 vaccination to include unpaid carers and people with mild to moderate learning difficulties. You've asked those not already known to the system through benefits or their GP to come forward. Will this identification process be proactive as well, or is it down to the individual to have heard what you've said today? And when each is found or has come forward, will there be a screening or vetting process? If so, how will that work? And can you assure our viewers that it won't end up feeling like a universal credit style interrogation? Thank you.
I can absolutely give a guarantee of that. We will set out more details of this. Gregor may want to say more about it just now. We'll set out more details shortly. It will be obviously the most reliable, proactive way of identifying carers other than eligibility for carers allowance or receipt of carers allowance is people who are known to their GP. Beyond that, yes, if there are other proactive ways that we can do to try to help with that, we will, but we will be reliant on people coming forward and registering because we can't know where all carers are. But we will make that as streamlined, as simple, as straightforward and as non-bureaucratic as possible, and we'll set out more details as soon as possible.
Yeah, I think the only thing I would want to add just now, Tom, is to give some reassurance. There's a long, a very good history of working between GP practices, carers and carers groups on a local basis so that we have very good recording systems and coding systems within GP practices so that people who provide caring responsibilities can be flagged in GP systems and that information can be extracted from them as well. So that will be something which will be incredibly valuable for us as we take forward what is a very complex part of the vaccination programme as well, but we'll also be looking for additional ways where we can make sure we're identifying further carers who may not be captured by that, and we'll set that out in time.
Thanks, Gregor. That concludes the questions today, so thanks to all the journalists for joining us. Thanks to Jill for our interpretation and to Gregor, and thanks to all of you for joining us. Please continue to stick with it. Everything is going in the right direction. We've got a lot of reason right now to feel a bit more optimistic than perhaps we have for the last few weeks. We're suppressing the virus, not easy. We're all having to make horrible sacrifices to do that, but the vaccination programme is going really well. And also the early evidence of the impact of the vaccination programme is really, really encouraging. So every reason to feel that little bit of hope and optimism that we've all been desperate for. But we know the worst thing we could do is to ease up too easy, because that could set it all back. So please continue to stay at home for now, unless it's essential, and follow all of the other advice and guidance and rules that are getting us into this better place. As I said earlier on, I will join you tomorrow from the Scottish Parliament around 2:20 and see you here later in the week. Thanks for now.